What is your career field?
Registered nurse. My current position or title is house supervisor. I work the night shift from 6 p.m. to 6 a.m. So I'm considered the administrator on duty, and so I'm responsible for the whole facility. Whatever issues happen, I have to be responsible in handling it. So such things as if I have to transfer patients out, if I'm receiving a patient that a doctor admitted, um, if there's patient complaints, things like that, staffing issues, I have to try to figure that out. If
Throughout your 11-year nursing career, have you ever run into an individual you would call a leader?
yes, my nursing managers, also people from different departments like risk management and the infection control, they help nurses to follow procedure and protocol on maintaining safety with patients uh, and the staff, the nurses that actually care for the patients. So yeah, I run into a lot of managers that are really good nurse leaders, and they help us to give the most efficient, quality, safe care that we can to patients.
What stood out for you about them?
Um, like my manager, her name was Michelle Zanakis. She was really good at making sure we knew the evidence-based practice of whatever procedure we were doing or how we were caring for the patients. She made sure we had the updated knowledge so that we would give the best care that we can and the safest care that we can to patients.
Um, would you consider yourself a leader?
In my position, yeah, it has to be a leadership role because you have to kind of take control of situations and make it work. Even if you don't have the staffing or the support staff, like on day shift, we don't have certain things available to us at night. So whoever's in that building at that time, we have to make that work with the staffing that's available. So yeah, I have to take control when emergencies happen or something that is unknown happens. Like for instance, security was making rounds and they found a dead body outside of the facility. So I had to figure out real quick how is this going to work and how did this happen. And so of course we all brainstormed on that together and out.
I
So,
see.
so that type of thing, yeah, it's serious stuff like that. And then it could just be some staff got sick on duty and then I have to find somebody to replace her. Or in some cases, being that we're a small hospital, I would take the patients over for the rest of the night.
Okay.
So it depends on how extreme the circumstances are.
Okay. Um, have you ever had a leadership moment?
Yeah, when we have emergencies, because we have a very small ICU, it's only a two-bed ICU, and so we have one ICU nurse. But when if somebody goes critical on the medical surgical floor that this ICU is connected with, um, I have to step in and guide the nurses on
Hmm.
how to take care of the patient or prevent the patient from getting worse. And there was a time where a nurse was trying to get in touch with the hospitalist, the doctor that's on call for us 24/7, and I guess the communication between them wasn't working, and the doctor didn't realize how serious it was. So I had to step in and say, "Hey, Dr. Fernandez, I have to call rapid response and get people up here on the floor now to see this patient." Because I guess he was refusing to come in, and he should have, but he did not in that situation. So I just called the rapid response, settled the situation, and I kept the communication between me and the physician. Since him and that nurse just for some reason we could not communicate well together.
Um, what do you think, based off your years of experience, a great leader needs?
A great leader needs to be open. Um, you have to be open, and you have to have a lot of patience because being a nurse, you deal with the public, so you're dealing with a wide range of psyche there. Some of them are not all, that it's not easy to actually, let's see, they can't. Some of them just can't take direction, or they're not. Their communication skills are poor, or they actually have a mental illness. So you have to know how to approach things like that. So yeah, you have to be very patient, open-minded, and flexible because there are just strange situations, and you have to try to figure that out professionally without causing harm to patients or to the patients that we take care of. Sometimes it's the staff that actually has the issue. So yeah, it's a good mix.
Okay. Um, do you think anyone has the potential for leadership?
I believe they do with the right guidance, training, um, education. Yeah, I think people can be leaders because we all have certain strengths that can actually assist people to move
Yeah.
forward. I have this nurse that I love her to death. She's responsible for a lot of the neonatal care that we have in our labor and delivery department, and she actually created Ryan's Law, which is it's a protocol that we have to do with newborns when they are in distress, and you got to do like a code on them. And so she created that here in New Mexico, Ryan's Law, and she's very into evidence-based practice, and she's the sweetest, most tame, soft-spoken woman you ever heard, but she's really, really passionately involved in what she teaches. And so you have different leaders who are like really aggressive type personalities. Then you have somebody like her who's super nice and soft and like you just want to hug her almost. But she's really good and she's good at actually getting you to understand why these processes are necessary and um, how fast you need to respond. Because with babies, if they go bad, she's this is her statement she always says, which is really cute, is that if they're not breathing, and if their heart stops, because if a baby's heart goes below 60 beats per minute, that is a code. You have to give them a code. Their heart didn't stop. If their heart stops, she says if you're already giving CPR, you're doing compressions on the baby. She calls them 90% an angel. So she was like, so you really got to be aggressive with children. So she's really sweet and she brings that home with comments like that. So she said they're already at 90% of angel at this point. So you really need to know what you're doing when you're doing the CPR and putting the UVC, which is it's a IV that goes in through the umbilical cord, so that we can give them adrenaline, epinephrine. There you go. That's what we give the adults. But with them, since they're little babies, you can't just start IVs and just start pushing. So we use the UVC, and it goes to the umbilical cord, and then you just give the thing. So yeah, each leader has their own strengths, and yes, I think that there's different persons can definitely be a leader.
Okay. Has anyone you consider a leader taken notice of you or your skills?
My manager of my unit, Christian Trotter, in 2014, she's the one that came to me and said, "Hey, uh, I've noticed how you work. I think that you would be good for a house supervisor." Um, and I also had recommendations from other coworkers of yours for the position. So yeah, I had other people notice, which I didn't realize. I was just doing my job. So yeah, it was interesting that somebody noticed that, and then they approach you, and then they offer you a position. So yeah, that was interesting because you don't think that happens, but until it does happen to you, you're like, oh, okay. Then you feel, well, okay, I'm good.
How do leaders bring groups or individuals with differing opinions together? How do they reconcile them?
In nursing, what they do is they have the staff meeting. So you have like everyone from the department on both shifts come into the meetings. They usually have two different times set so that they can get a diverse opinion on circumstances or a diverse education given
Yeah.
to the staff and at the same time. So that's pretty much what they do. We have the staff meetings and then certain leaderships, like for instance, we just had a conduct awareness meeting with our ethics department. And so what they did is they got the house supervisors, the charge nurses, and managers together. And so they went through that situation to go over, well, how do you handle certain situations and who would you choose to go to? So they wanted to know, we knew what the protocols were for various incidents. So yeah, that's what they do. They gather to meet together and they'll get different people from different areas of nursing together. And
Okay.
sometimes outside of nursing, because we actually had a registration tech that was there. And she was like, why am I here? I'm not in nursing. But she was responsible. She needed to know some things too, because she's the one that admits people in.
Yeah.
at night and stuff. So she would need to know if this certain situation happens. Well, this is who we get in contact with. Or HR needs to get in contact because of this, or issues like that.
Okay. How can novices best attain leadership skills?
Notices?
Novices, novices.
Oh, novices.
Novices.
Oh, okay. Novice. Okay, like for me, I'm very novice in the labor and delivery department.
Mm-hmm.
But when they have their emergencies, like for instance, one emergency they had was a patient hemorrhage after she gave birth. It was a vaginal birth, and the husband was standing by the bed too, so it was a lot of pressure for the nursing staff, and they were kind of short-handed. And the doctor was busy doing what he needed to do for the patient, but we had to get blood and we had to get it in there like quickly because she was hemorrhaging a lot. And so I did my part. I'm novice in labor delivery, but I knew with my intensive care skills what I needed to do: get large bore gauge IVs in, get that blood up there immediately. So I called down to the lab, had the tech come up, had the doctor sign the emergency release, because usually when you request blood, they have to do this whole process to make sure the patient is not allergic to it, so we don't have a hemolytic type of reaction that could possibly kill the patient. And but in those cases, we just do O negative, which is safe, universally safe to give. And so they come up, and then I get the pressure bags, hooked it up to the IVs, and had that going. And then I would just ask the labor nurses, "What do you need me to do? What else is there for me? What else can I do for you?" Put it that way, because I know that this is not my world. So, but they were on point with what they did, and they let me do what I was comfortable doing. And then us working together from our different skills of nursing was able to help that woman, and she was fine.
So you'd say asking questions and having more experienced people to help you is
Absolutely,
best.
absolutely. When you don't know about a situation, to help a novice, a novice leader or possible leader, to learn, they have to ask questions. They have to know to ask what resources are available to them, like the staff that's right there. Ask a nurse that's in labor delivery, because obviously I'm not a labor delivery nurse, so this is my lifeline. Okay, what do we need to do next, or what do you need me to do for you to help you in whatever you're doing, things like that. So like one another instance, like in L&D, they were not used to giving potassium IV, and I give that a lot in ICU. So I did that. I started the IV, got it going, had it at the rate that it should be, had the normal saline running in so that the patient doesn't suffer. Because potassium is a molecule that's very, very irritating to the veins. So it burns as it goes in. So you have to do certain steps so that you don't make these patients suffer. And so they wouldn't know that, so they asked me to do it, and I did it while they were doing other things for another patient that was not critical, but she was having problems during labor. So yeah, you have to work together and use the resources that are near you, especially when you're novice. Because when you're novice, obviously you don't know anything. So you got to ask the people who are around you, because especially if they've been around for, like, they're nurses who've been nurses for years. So they're the ultimate resource to go to.
I see. And I guess lastly, if what are 5 characteristics you think a great leader must inhabit?
They need to be meek, teachable. They need to be firm. They need to be knowledgeable in their area. They need to be, let's see, they have to be definitely open to diversity. If you don't have diversity, it makes your job like 10 times harder. You have to get different opinions, different ideas from different people. I mean, a PCT, a patient care technician, or a CNA, as they're usually called, they can give you a wealth of information because they're the hands-on caregiver of your patients in the hospital. So things like that. What else? The fifth one, I would say, um, hmm, well, you definitely have to have integrity too, because you want to do things correctly, fairly. Um, you want to look at the situation and get both sides of the situation, whether it's a patient complaining about a staff member or a staff member having issues with the patient, and so that you can handle it appropriately. So yeah.
Well, thank you for showing.
Thank you.